Hi, it's Dr. Lamia Gabal again, and I'm here today to speak to you a little bit about the female reproductive system and some changes that happened after menopause and things that we can do to help you with these changes here at Prestige Medical Group. So this is an excellent schematic, a nice drawing that shows us the uterus, the fallopian tubes, the ovaries, and then also the vagina with the external genitalia, including the labia, which are not seen as well here, but the labia minora and majora, the small and large labia. So as you can see, what happens as we get older, we lose estrogen everywhere because the ovaries will stop producing estrogen as we get older. We have a limited amount of eggs that will be releasing estrogen. And so as we age, the ovaries will shrink. We have less estrogen. That makes the uterine lining thin. That's why we stop having periods, which is not a bad thing. But then other things also thin out, including the vagina. It gets narrower and shorter. We get less lubrication during sex because of the dryness of those glands. And then also the external genitalia, the labia, become less elastic. You lose fat. And so some women also have some concern over the appearance of the external genitalia being sort of floppy and, the internal labia being maybe bigger than the external labia. So there are lots of things that we can do to help with these symptoms. If you're having vaginal dryness, burning, itching, trouble with lubrication, pain with sex, if you're having urinary tract infections, or if you're just concerned about the appearance of the external genitalia, estrogen cream has been shown to be very helpful. It is actually very safe. I know many women are concerned about using estrogen in the vagina, but a very minute amount even gets absorbed into the bloodstream. And so estrogen really is very safe. Let's get that back up. It's very safe to be used in the vagina, and it helps for all of those symptoms. Also, if you're concerned about estrogen or you prefer not to be using the cream 3 times a week, the Monalisa is an excellent option for vaginal atrophy. It helps for dryness, burning, itching, trouble with lubrication, pain with sex. It can also help with the appearance of the external genitalia if there's a concern there, and can help with recurrent urinary tract infections, just like the estrogen can be helpful for recurrent UTIs. And then for general appearance of the external genitalia, we have other options that can be helpful as well, such as a labia plasty, which is a small surgery where we would cut the inner labia so that it's now an innie and not an outie. Or what actually works better for us who are postmenopausal is something called a vampire wing lift, which is where we take PRP, which is platelet-rich plasma, and we put it into the labia majora, which then gives you more a bulky appearance to the external labia and a more youthful appearance, because that's what we look like when we were younger before we lost all that fat there. So if any of this is a concern for you, please let us know and we'd be happy to help.